Hello Jules, Bontali here, and I just want to talk to you today about being a new nurse. I know things can get overwhelming, and I know that things are hectic right now, but I just want you to know that you'll pull through it. Right now, I'm in my 3rd week of nursing, and it has been really hectic. I've been having to communicate with physicians more. I've been having to deal with other things like juggling patients, and nursing school doesn't teach you that aspect of nursing. It's a little different, and to be honest, nursing is way more than what they teach you in school. When you get out of there, you're gonna feel like you don't know what you're doing, and it's okay. But eventually you'll come to terms with the things that you're doing, like juggling patients, facilitating communication with a physician, knowing when to place an order in, knowing policies and procedures, and especially learning the charting system. These things can be really difficult for a new nurse. To be honest, my days aren't all peachy green. Sometimes they're a little bit more hectic than, others. And it may not be all the way because of like what I deal with my patients, but it may be because of the communication between me and physicians, or I'm like nervous or overwhelmed. Or sometimes it may be, because you and your preceptor have a miscommunication, meaning like you're asking a question, she may not understand it, but it's just like a whole hit and miss there. But I want to tell you about my first days as being a new nurse, and I just want to let you know that nursing school does not prepare you for this. Like, you feel overwhelmed, you feel overworked, and like everyone else says, underpaid. Most definitely. All I can say is this: hang in there and do your best. There are plenty of times where you're gonna feel like giving up as a new nurse, but I want you to just stick with it. This is your career, this is your journey, and you're gonna do just fine. Right now, I think my biggest struggle is like learning the charting system there, and also facilitating communication with the physician. Sometimes you hear these like horror stories about physicians and how they like bite your head off, but all of them in actuality aren't like that. You have some really nice ones who actually facilitate learning and love to communicate with you. And that's the good part about it. But you kind of have to have a tough skin with it, because you may have those physicians that aren't like that, and they may bite your head off for ordering SCDs for a patient when you know they need it, like prophylactic for clots. I'm just giving an example. Nothing that I had to do, but just giving it a random example. If you would like to hear more about my nursing journey and what I actually do during the day, not patient specific, but how it is for me, then please like and subscribe. And if you have any questions, please feel free to comment below. All right, Jules. Later.